something. In 3.5 months, we are going to, at the ballot box, send a shot heard around the world about who we are. And it is going to reinforce our values. The fact that we love each other, we take care of each other as a nation. So if they think it's hot right now, we're going to turn up the heat a little bit more on Trump care. We're going to make sure that it fails. Tim's going to go back to D.C. this week and do something that we all know he's going to do, which is to lead with our values. And I want to, without any further ado, bring up a man who I admire tremendously, who we in Virginia are so fortunate to have, who we really in this nation are proud to call one of our best and brightest, our great Senator, Tim Kaine.
Hey guys, good to be with you. Hey Roanoke. Hey Roanoke College. Thank you so much. I am so happy to be with you. I can't tell you how good it makes me feel. And I'm going to talk a little bit, if you don't mind, a little bit about the battle before us. And then Delegate Sam Rasoul, he's just right here. So Sam, we're going to have you be our closer. When I'm done, I'm going to have you come up and close us for the Roanoke Valley. Are you up to that? Give Sam a round of applause. It really is a treat to be here at Roanoke College and be in Roanoke. Many of you know my wife's a Roanoker. We have family here. We have friends. It's been my pleasure to represent this area in state office as lieutenant governor and now as a U.S. senator. This is a place of heart, and we're here on an issue of heart. We deal with a lot of issues. We don't deal with any issue that's as important as this one. This is not just an issue. This is about who we are as Democrats. This is about who we are as Virginians. This is about who we are as Americans. And when it's fundamental, when it's about who you are, you can't flunk. You got to succeed. You've got to pass. You've got to do the right thing. And that's what you're helping us to do. So to thank all of you for coming out, and we'll just have a bit of discussion here on a hot day. It is hot, you know, being out here on what might be the hottest day of the summer. But we sing a song in my church, and the lyrics are, "We've come a long way, Lord, a mighty long way. We've come a long way, Lord, a mighty long way. We've borne our burdens in the heat of the day. But you know, the Lord has made a way. We've come a long way, Lord, a mighty long way. And we got a ways to go. And we'll go that distance and do that work and battle for justice if we do it together." You ready to do that? Even on a hot day? So, first to thank Roanoke College. Tanya showed us around earlier. Tanya Ridpath is the Director of Community Programs. Give Tanya and everybody here at Roanoke College a round. My longtime friend, Roanoke Mayor Sherman Lee, so good to have you here. We heard from Sherman. We heard from our county and city Dem chairs, Susan and Stephen, two great legislative candidates, Juna and Steve. Other candidates are here. I'll tell you, I'm so proud of Justin Fairfax. Isn't he going to be a great lieutenant governor? Forgive me for being biased. I think lieutenant governor is a really important job. I mean, it is an important job, and he did such a good job in that primary, and he is battling with such energy all around the Commonwealth. And what about a ticket? Mark Herring has done such a good job as Attorney General. Ralph Northam is LG, who's going to be a great next governor. This ticket is a ticket we can be very, very proud of going into November. And you are going to have the ride of your life. It's going to be so challenging and so tough and so exhilarating. But you're fighting for the values that are most at the core of who we are, Justin. And we're proud that you're out on the battlefield for us. And we're going to do everything we can to make sure that you're in office, presiding in the Senate of Virginia as we get Medicaid expansion done, as we do all kinds of other things in this Commonwealth. Couple of stories, and I want to tell you what we're voting on this week in the Senate. So, yesterday, I did something that I've been doing since 2002. I drove down to the Virginia-Kentucky Fairgrounds in Wise, Virginia, where a couple of nuns, Sister Bernie and Paula and Teresa, started this health wagon, St. Mary's Health Wagon, providing free medical care to people in Appalachia. You know, my wife's from Roanoke, but her dad is from Big Stone Gap in Wise County. And these folks started this in the late 1990s. And in about 2000, they started a fair at the fairgrounds where they would basically come and just anybody who needed health care could show up. And, the first year was probably a few, and then it grew, and then it grew. When I went in 2002, it was only a couple years old. This is the first time I went. I was lieutenant governor, and I wanted to go because I'd heard about it. I wanted to go volunteer. And I'll tell you what it was the first year I was there, and I'll tell you what it was yesterday because I was back. People start to arrive in this dusty fairgrounds, and the weather's just like this, hot as can be, and they start to arrive maybe Tuesday or Wednesday, parking their cars in the fairgrounds, waiting in line so that Friday morning, when the door opens, they can be given a number. And sometime over the course of the weekend, they can get health insurance. They can have their teeth checked, and usually it's teeth being pulled because they're past the point of saving. They can be given an eye test, maybe get glasses for the first time in their life when they should have had them 10 years ago. They can get a cancer screening. They can get basic, female health care, or they can get basic vision or hearing testing that they can't get anywhere else. And they come by the tens, and then by the dozens, and then by the 50s, and then by the hundreds. And when the door opens up on Friday morning and they hand out the numbers, you're into I was there at 8 a.m. yesterday, and they had already given out 1,500 numbers, people who've camped there. And then all weekend long, they go to this great bunch of volunteers, and they get compassionate care. First year I went, 2002, I was working, and I was struck, heartbreak and uplift. There's the uplift of all these beautiful volunteers who are from all over not just doctors and nurses, but the Lions Club. They do vision screenings. People come from all over the Virginia and all over everywhere to volunteer, and that was so uplifting, but it was also so heartbreaking to see people who haven't been to doctor in so long, who live in the greatest nation, the most compassionate nation, the wealthiest nation in the world, in the history of the world, and yet this is the way we do healthcare. This is the way we do healthcare. I was there, and it reminded me, I was a missionary in Honduras, and Honduras in 1981, next to Haiti, it was the poorest country in the Americas. That's the way they did healthcare in Honduras. There wasn't a healthcare network. You'd show up if some doctors came from the U.S. one weekend a year to try to get healthcare, and yet this is in my own commonwealth and in my own country. But the thing that really sunk the hook that first year was when I was walking through the parking lot. So I'd been in volunteering and thanking people. I was walking through the parking lot. I knew I'd see cars from Virginia and Kentucky. Kentucky's 10 miles away. I thought I might see cars from West Virginia or Tennessee or North Carolina. They're 100 miles away. But I didn't think I'd be seeing cars from South Carolina or Georgia or Alabama or Oklahoma, seeing cars because people need health care in this country. And when they can't get it and they hear about something like this, they will drive for hours and days, for hours and days, so that they can be treated. Well, I went back yesterday and said thanks to the volunteers and went and sat in the registration booth. And as I was registering people, hearing one story after the next, the question you always ask, how many years has it been since you've seen a doctor? I had a mother of 4 kids. Well, boy, it's been a long time. 4 children, young children. How many years has it been since you've seen a doctor? Because if you've got 4 young kids, I know they bring home various things from school. You've been sick before. Mom, when was the last time you saw a doctor? Was it in the last year? I don't think so. Was it in the last 2 years? I don't think so. Was it in the last 3 years? Might have been. I'm not so sure. And this was again and again and again what you hear. And so that experience yesterday, right here near us, tells you what this is about. I then went over to the children's campus, which is a campus in Abingdon, Washington County in Bristol, kids who need mental health care, mental health, substance abuse treatment. Kids who don't have a substance abuse problem, but because their parents do, they're living in such difficult circumstances, they need help. And we talked about Medicaid. We talked about the cuts that the Republicans are proposing to Medicaid, $1.3 trillion over the next 10 years in the Trump care bill plus their budget cuts. 50 to 60% of Medicaid recipients in Virginia are children. 20% are the disabled. About 15 to 20% are our parents and grandparents in nursing homes. And we talked about what Medicaid cuts would mean to children. About half the births in Virginia are paid for by Medicaid. And then if a kid has a disability and needs help, that's paid for by Medicaid. And then when a kid goes to school, the Roanoke school system has to provide an individualized education plan to meet that child's special need, and that gets reimbursed by Medicaid. And if a kid goes to a court, a kid like used to come to my wife Ann's court, who's doing everything right, who's trying to succeed, but the family is a disaster because of domestic violence or drug abuse, and the judge is like, I'm going to have to put this kid in an institution even though the kid is doing everything right. Can I send a counselor into the house 5 hours a week? Wouldn't that be better for the child than putting him in an institution? Wouldn't that be better for the faculty? That's paid for by Medicaid. If we cut Medicaid, we're hurting kids. We're hurting the disabled. And then right before I came here, I had coffee at a place. I don't know if any of you guys know the place Zorba's, that's here in Salem. Classic place. And I walked in and the guy came up and said, you got to save Obamacare. This is how I get my health insurance. He recognized me. You got to save Obamacare. This is how I get my health insurance. And so, believe me, standing in front of you and having those stories, I can't wait to get back up to Washington Monday to have what I think is going to be the battle of my first 5 years in the Senate. I'm not sure I'm ever going to cast a more momentous vote. There's not going to be a more momentous vote than the one we're going to cast, because it is a fork in the road, my friends. It is one side of that. If we allow the one-party repeal effort, we will hurt tens of millions of Americans for no reason, for none. That's what they're trying to do, and we have to defeat it. We have to. We have to. And on the other side of the fork in the road is, let's work together to improve health care.
Yes.
I don't want to accept the status quo. I think we ought to be getting better. We should be covering more people. We should be bringing down the cost of prescription drugs. We should have more mental health provision that's easier to access. We should make medical clinics, free clinics, sort of a thing of the past. Teresa and Paula, who run that clinic in Wise, they say, we want to be out of business. We want everybody to have health insurance and coverage so they don't have to go camping for 4 days in a hot sun to get health care in this country. So that's the fork in the road that we're on. And I'll just tell you, you've already made such a difference. You've made such a difference, and I want to tell you why. Justin talked about the rally that we had on Capitol Square on MLK Day in January. It looked pretty bleak. You remember what they said? President Trump said, we're going to repeal Obamacare on the first day in office. That's what he said. And they were set up to do it. And, you know, that was no joke either, because I've been in the Senate 50 times they voted to repeal Obamacare. So when they say they want to repeal it, and now they have the majority in both houses, I take it pretty seriously. But we're way past the first day in office. We're all the way to 6 months later, and they haven't repealed it yet. Why haven't they? When they did it 50 times before? Because of you. Because you have marched. You indivisible groups, you have put together this chain for everybody in your county that would lose health care, and it's 3 miles long, and it's getting national media attention. You've made calls to Senate and House offices. You've gone to town hall meetings. You've emailed. You have done everything that James Madison said we're supposed to do. If we're members of the public, the First Amendment, the right of the people to peacefully assemble and petition your government for redress of grievances, it's a right that we have guaranteed, and we have used that right to tell these folks that they can't hurt people. And that's why they haven't been able to do what they said they were going to do on day one, because of you. I've not seen anything like this. I've been in the Senate for 4 years before President Trump was inaugurated, so I know how many people were calling and emailing my office every day. And I know how many it's been since. And the answer is it's been a whole lot more. There are 3 or 4 times the amount of contacts coming into our office. And while it's about a lot of things, the biggest driver by far has been healthcare. Doing the right thing about healthcare. So can you give yourselves a round of applause for doing something that nobody thought we could do, and making it tough for these guys to do what they said they would do? Thank all of you guys. Thank all of you. So here's what's going to happen this week. Mitch McConnell, who is a good arm twister, I got to give this guy credit. I don't agree with him on much, but when he sets to twisting arms, he's a good arm twister. And he has been trying to twist enough arms to get a one-party vote through with 50 votes and have the vice president break a tie. Now, what bill they're going to put up, we don't know. They have so many different versions. It's like a 3-card Monte game. They're just switching around. But I'll tell you, they're all bad. Yeah. Because the CBO scores them as fast as they can throw out a new one. And look, does it really matter whether the bill they put up kicks, only 22 million people off health insurance instead of 32 million. That's sort of the range that we have. The plans are going to kick all these people off health insurance. They're going to drive up premiums, especially for seniors. They're going to cut Medicaid and hurt kids and the disabled. They're going to hurt people with pre-existing conditions.
Yes.
This is an outrage. If you're born with a pre-existing condition, if you're a kid and you get diagnosed with leukemia, do you want that hanging over you for the rest of your life where you can't get health insurance because an insurance company says, I only want to write insurance to people who are well. I don't want to write insurance to somebody who's sick. That's what's at stake. And they're going to try this week, probably first vote Tuesday, and then it may stretch for a couple of days. They're going to try to see if they can find some votes, find 50 out of 52 Republicans. 50 out of 52, that's what they need to vote for a repeal of the Affordable Care Act. And we are going to do, as Democrats, everything we can to stop them from getting there. But the big vote will be this week. The big vote will be this week. Now, there will be 2 votes. They need to get over 2 votes to make it happen. They need to have a vote probably on Tuesday to get onto the bill. We call that a motion to proceed, to get onto the bill. And then they would need a vote to pass the bill. So even if they succeed on the motion to get onto the bill, they still have to get that 50 votes plus the tiebreaker to pass it. So we might be able to stop them from even getting onto the bill. That's what we're going to try to do. One Republican, Susan Collins, has already declared, I'm not voting to get on the bill. And I don't care, and she said, I don't care if it's the version that kicks 22 million people off or 32 million people off. All the versions are bad. I'm not voting to get on that bill. So that means they're at 51. My friend John McCain, who has said the Republicans should scrap this foolishness and put the bill into the health committees and have a real meaningful process that would listen to the American public, right? So he's not likely to be there because of his sad news that came out this week. And so that means they're right at 50. If they lose one more, they can't get onto the bill. But even if they get on the bill, then we'll debate and we will try to convince them that they shouldn't vote for it ultimately when it passes. So I cannot tell you how important this week is, and I cannot tell you how your calls to Mark and me, to senators in other states, one very close to us, Shelley Moore Capito, West Virginia. She said something powerful the other day. She's one of the votes that we ought to be able to get because, believe me, if Virginia has health care challenges, West Virginia has health care challenges, has big ones. Opioids, other challenges. And Shelley Moore Capito said the other day, I didn't come here to hurt a lot of people. I didn't come to the Senate of the United States to hurt a lot of people. That was a Republican who said that. So reach out to her office, reach out to other offices, and we can win on this. And if we do, let me tell you what the next chapter is, and then I'll conclude, and we'll have Sam come up and be a little bit of a closer. The next chapter is not, let's be real clear, the next chapter is not, oh great, we defeated the Republicans, so we can just relax now. Because President Trump has made clear that he's going to do anything he can to sabotage Obamacare. And so even if the Republicans can't pass their bill, this president, instead of worrying about the health of Americans, has said, great, we'll try to sabotage it and let Obamacare fail. And a whole lot of people will get hurt. And then we can stand up and say, see, we were right. He ought to be thinking about people's health care.
Yeah.
That's what he ought to be thinking about. Not about his jealousy about President Obama and his desire to undermine an Obama accomplishment just because it was President Obama who did it. He ought to be thinking about people's health care. So what I mean to tell you is if we win this week, all we have won is an opportunity to be about a next chapter where we are going in and trying to find improvements. Now, in Mark Warner and me, you've got an interesting pair of senators because there's 2 committees in the Senate that work on health care. One is the HELP Committee, Health, Education, Labor, Pension. I'm on that committee. One is the Finance Committee that does Medicaid and Medicare. Mark's on that committee. If we win this week on this vote, what's going to happen is the committees are going to take over. Committees in a Republican Senate with Republican majorities. But we will have the chance finally to actually sit around a table with our colleagues and have a discussion about improvements to the healthcare system. And more important than that, when you let the committees operate, you let the public into the room. Now we're not talking about a secret plan. Now we're talking about an open committee room with a witness table where you can have a patient and a doctor, the American Cancer Society, a small business, a service provider come and sit down at the table. And representing the public, what they do is they come and sit at the table and they say, here's what I like, here's what I don't like, here's what needs to be fixed. We've got to open the door, we got to open the windows, we got to let the sunshine in and let the public participate in this rather than one party trying to do it as a secret behind closed doors and then jam it through right on the floor. I'm going to tell you how naive I am. I'm 59 years old. I shouldn't be naive, but I am naive. I've been trying to get on the Health Committee in the Senate since I got there in 2013, and I couldn't. I'm on great committees, Armed Services, Foreign Relations, Budget. But I've been a mayor and governor. What do I know? I know healthcare and I know education. That's what I know. And so I wanted to be on the committee that worked on healthcare and education, and I couldn't get on when I got into the Senate. But this year, this was my consolation prize for being on a national ticket and losing. It's like Chuck Schumer comes to me in November, and he says, now, how about being on the health committee? Yes, I'm finally, I'm on the committee. Now, I am so naive that I actually thought being on the healthcare committee, I actually can participate in health. Boy, was I naive. I got on the committee on the 3rd of January. On the 5th of January, 48 hours later, I had pulled together a group of 13 Democrats. We wrote a letter to Mitch McConnell and the 2 key committee chairs. We said, look, you want to improve healthcare? So do we. Let's sit down right now. We're ready to sit down right now and listen to your ideas. You listen to ours. We'll find improvements that will help people out. Well, that was on the 5th of January. Donald Trump has been saying Democrats won't participate. On the 5th of January, I asked for a chance to participate. And my committee, the Help Committee, since the 5th of January, we've had hearings on nominees. We've had hearings on education. We've had hearings on the FDA. We've had hearings on pension and labor issues. There's only been one taboo topic
Healthcare.
on the Help Committee since I got onto the committee, and that has been healthcare. We haven't had one hearing. The majority calls them. They will not let us have one hearing on the House bill or on the Senate bill or bills. We have not had one hearing. We have not heard from one patient, one doctor. We haven't heard from anybody, and they're trying to do this in secret. And so what I'm saying now is 7 months of trying to do it wrong, no wonder you're about to do something wrong or maybe fail at doing something wrong. Let's do it right. Woo! Let's open up the door and open up the windows and let the American public participate and get good ideas and improve our healthcare system and cover more people and bring down the cost of prescription drugs. And so that's what I hope we'll get to this week. So please keep up your effort and keep your calling. Please keep up your advocacy for these great candidates. You know, the thing that I really like about our state ticket is, man, what a good time to have a guy running for governor who's a pediatrician.
Yeah.
I mean, if you could be running for governor as a pediatrician, would there be a better time to be doing it than right now? And what Justin said, we'll send a message because this is the first race since the inauguration, but we'll also send a message because we've got a compassionate ticket that's up that knows how to be a compassionate commonwealth where Virginia is for lovers. They know how to do this, and we can send a message about health care and about a community where we care for each other and we don't leave anybody behind. And so for coming out on a hot day, I mean, it is a hot day. This might be the hottest day of the summer, but, you know, we wouldn't have done it if it wasn't important.
You're hot.
We wouldn't have... You need to see a doctor, an eye doctor, my friend. We wouldn't, none of us would be here if it wasn't important. Because look, if you just think, I'm not asking anybody to say anything, who in your life is grappling with a health issue right now? Somebody with an opioid addiction. Just get a face in front of your mind. Somebody with an opioid addiction. Somebody in your family dealing with dementia. A youngster with special needs who's just battling to be all he or she can be in a public school system. Somebody who's got a bad cancer diagnosis like my friend, my chairman, John McCain, but who's like, but I'm going to battle it. I'm going to battle it. If you just think about these people in your lives, I know there's too many faces crowding into your head. You can't think about it. This touches all of us. And it's sad to see some treat it as just like it's a political issue, or it's just like we had a hearing with the director of the budget office, and he thinks healthcare is just like numbers on a page. I asked him about the Medicaid cuts. Mick Mulvaney, he was in Congress. He's now the head of the budget. I asked him about the Medicaid cuts, and here's what he said. It's almost a direct quote. We're no longer going to measure our compassion by the number of people on these programs. We're going to measure our compassion by the number of people we get off these programs so they can take control of their own lives. All right, so a senior with dementia in a nursing home. We're going to measure our compassion by the number of people we get off these programs so they can take control of their own lives. This child who wouldn't be able to go to school if Medicaid wasn't paying for the wheelchair so they could go to school. Well, we're going to measure our compassion by what we can take away from these people. They got to get their head out of the budget book and put their heart into real life with their neighbors, just like these people that you're thinking about as we close here. People are counting on us. There's a beautiful phrase in the letter of Paul to the Hebrews in the New Testament that talks about we are surrounded by a great cloud of witnesses. Each of us, as we advocate, each of us as we vote, each of us as we put politics in place, policies in place, we are surrounded by a great cloud of witnesses. Some who are right next to us, some we'll never know, some who are here, some who have gone. We are surrounded by a great cloud of witnesses who are saying it's all on the line. This is about the most important values that we have. We can't afford to get this wrong. We can take the time and listen to each other and get it right. And that's what we're about. Aren't you proud to be part of that fight? And I'm so proud. And I'm so proud to be here in this fight with you. Now, let me bring up a great member of the House of Delegates who will do a little close. Sam Rasoul. He's been a breath of fresh air in Washington. I know he worked so strong with you. And he is a Roanoke College grad. So welcome him, Sam Rasoul, to the stage. And Justin, come on up too.
Well, hello, Roanoke College. It's certainly a pleasure to be back here on campus as a Roanoke College alum. I don't know, if you all have looked around, there's been a lot of changes here. I'm certainly proud of Roanoke College, that's for sure. One thing that for sure has changed, nobody could figure out when I was here what exactly the heck a maroon is. We're still trying to figure that out. But one thing I definitely would love to do here at my alma mater is, Senator, that 3-mile chain, I've got a piece of that for you. And Justin, we've got a piece of that 3-mile chain for you all. And I would love to, if you'll indulge me, because I'm one of these terrible millennials trying to ruin America. If you'll indulge me, I'd love to take a selfie with this big crowd. Let's give a big round of applause. Thank you. Thank you. So do we have anybody here that speaks Spanish? I know one. I've got this wonderful shirt here. So by the way, I'm the closing act. So I'm not going to say anything particularly smart, but I've got this Virginia is for Voters shirt. And I'd love to give it away. Who can speak some Spanish? Raise your hand. Please come here. If you want to win this shirt, I would love for you to tell Senator Kaine why you love him being your senator in Spanish. And then we would love to see, of course, the senator with a short response. Come on up.
Fabuloso, and tú quieres toda la gente.
Pues no soy tan grande. Soy un hombre sincero y un hombre humilde, pero para trabajar juntos con la gente es el honor de mi vida. Entonces, gracias para todos y hasta la victoria.
What he said. I agree with him 100%. When you think about our country, Senator, our first American promise is what? The life, liberty, and the pursuit of happiness. And you talk about health care, I think that there are very few promises we can keep with regards to health care that really fulfill that promise. How many families are torn apart for a variety of reasons. And this month we've lost 2 of my friends to health care. a gentleman named Tom Kaine. He's been a fighter for social justice for many years. He was well into his 70s, lived a great life. We're very proud of him. But then there was my friend, about a little over a year ago, was diagnosed with cancer, and he's 9 years of age. And he about 3 weeks ago, he asked his mom, "Mommy, can you fix me?" On July 8th, the good Lord took him, and he's on into a better place. But I can, as a father of three myself, think of no greater promise of health care to ensure that this first great American promise of life, liberty, and the pursuit of happiness happens for every American. You know, the reason why we love Senator Kaine is because he is a sincere fighter. He's a sincere person, and I think that there are a number of pieces from his background that help with that. Those of you that know me know I'm a big fan of Pope Francis. I think that he leads with compassion. He doesn't even tell people he's going to pray for them. He says, "Will you pray for me?" And there's service with humility there. And certainly, Senator, we see that service with humility day in and day out with all the great work that you're doing. And of course, we're going to be seeing that come January with our new Lieutenant Governor, Justin Fairfax. So, Senator, you would have made an awesome vice president, and then, of course, president. Maybe we're not done with that yet, but Virginia gets to keep you for a few more years, so we're excited about that. But I am happy to be able to fight with you day in and day out. I came prepared. Today I have my Muhammad Ali socks on. So we are ready to rock and roll and to fight with you every day moving forward. Thank you, Senator, for all that you do. Thank you all for being here and for fighting for health care for every single Virginian.